Good afternoon, friends of the media. Welcome to the afternoon press conference. Wish you good health and all the best in the new year. The CEO will speak, and then there will be questions taken from you. Chief Executive, friends of the media, citizens of Hong Kong. This is the first day of the Chinese New Year, the Year of the Red. First of all, I wish you all the best. I wish you peace as well as the good health in the new year. Now, according to my understanding, some newspapers are on holiday, but still, many of you are still here to attend our press conference. Thank you. For the theme of today's press conference, of course, it is about the latest progress about the novel coronavirus. On the 31st of December 2019, we were notified. You would recall that on 2 occasions, I came out to notify you of what we have done in relation to our work to control the virus. We have never let ourselves be off the guard. We respond quickly. We have highly vigilant, and we are open and transparent. In particular, for openness and transparency, for the past 3 weeks, there were altogether 58 press releases. Officials, including myself and Professor Sophia Chen, met with the media for 27 times. And then relevant officials, including myself, the CE, the Secretary for Food and Health, visited different locations, in particular the port health facilities, on more than 10 occasions. I want to emphasize that during the outbreak, we are most grateful to a few experts who are experts in the infectious disease as well as the clinical side of the matter, because we need scientific data to support our work, including Dr. or Professor Gabriel Leung sitting next to me. For the experts, for 3 weeks, they have been helping us endlessly, and they have been coming to our assistance whenever needed. We are most grateful. Well, of course, we have to be on top of the situation, and therefore the special administrative government have come up with 3 levels. And then, well, in the beginning, instead of just having it at the alert level, we raise it to the 2nd tier. There is the serious response level. Strictly speaking, at that time, we didn't even have a confirmed case, but still, we had already raised the response level to tier 2, namely serious. So we'll elaborate on what work we have done in order to be highly vigilant. Well, we have been preparing ourselves, including the isolation facilities at the hospital authority. And then we have to trace the close contacts. And therefore, we have taken over some holiday camps from the LCSD, so that in a few hours' time, we were able to use the facilities involved. Up to the 22nd of January, we then got the first preliminary positive case, followed by the second one on the following day. In the evening of the 23rd of January, both cases were confirmed. Both were confirmed, and then both were basically imported cases. We're talking about people who went to Wuhan before the onset. We have been tracing their close contacts, and if necessary, the close contacts will be asked to go into the quarantine facilities. For the past few days, there have been rapid changes in relation to the disease, as you know from the announcements on the mainland, and it has become serious. It has also caused a lot of concern and has caused a lot of anxiety on the part of our society. This morning, I came back from my official visit, and I announced that there would be a high-level meeting in the morning. We started at 9:30 in the morning, and we just finished the meeting just now. And we have listened to the views of 3 experts, including Professor Gabriel Leung, Professor Yuen Guoyong, and Professor David Hui. And we have got the details, and therefore we are here to announce a number of measures. For our strategies, there are 6 points. Under each strategy, we have certain concrete measures. First of all, we have to enhance our institutions. As I have said, we have already come up with our countermeasure in relation to the novel infectious disease of public health significance. We have come up with the preparedness and response level year 2020. And there are 3 tiers in relation to our response level: alert, serious, and emergency. The level has been raised to serious. Now today, I would like to announce that we are going to escalated to the topmost level, that is emergency. In other words, when our response level is pitched at emergency level, the interdepartmental coordinating committee will be chaired by myself, the chief executive, and we have a command center so that we can get the views from the experts and we can come up with the strategies as well as the initiatives. And then when we deal with this public health event, I think you would understand that sometimes we need to be very quick in making decisions. Therefore, having it coming under the chief executive, we can then make the decisions for the Society of Hong Kong. Well, according to the preparedness and response plan, when we have an emergency response level, it means that for this novel infectious disease, the impact on the population will be high and imminent. Well, we may not have a widespread infection and serious cases, but then, as I have said, we need to stay on top of the situation, and therefore today we have already raised it to the emergency response level. Other than the CE leading the steering committee and in control of the command center, under that, we're going to set up 4 working groups, and I will be brief. First of all, one to be chaired by Professor Chen. It is a prevention and control working group so as to deal with strategies concerning the infected cases and to liaise with organizations like the World Health Organization. The second working group will be an action working group under the chief executive so as to coordinate the work among departments against the disease. And thirdly, it is a community participation working group. As you can see from our slogan, Together Fighting Disease, we need all sectors of the community to take part in the fight against the disease. And it will be a working group to be led by the Secretary for Home Affairs. And then we need to be open and transparent. So for the 4th one, it is a working group on communication. In other words, we would like to be swift and effective in communicating our messages to the stakeholders as well as the population of Hong Kong. And it will be led by the Secretary for Constitutional and Mainland Affairs. And then for this steering committee command center, we need the continuous assistance of experts. So I have appointed an expert panel. Altogether, we have got 4 experts, well-versed in public health, infectious disease, and experts with rich clinical experience, including Professor Gabriel Leung from Hong Kong U, and we have Professor Keiji Fukuda, also from Hong Kong U. And then we have Professor Yun Kwok Yung, Chair of Infectious Diseases from Hong Kong U. And then the 4th one is Professor David Hui from CU Hong Kong. The 4 of them are forming an expert panel, and they will report their observations to me directly. And then in the light of their recommendations, I, as the chief executive, will consider their recommendations. In this way, we can shorten the time needed for communication, and then we can come up with the right response. So that's the first part of our strategy, or the first strategy. As to the second strategy, we need to step up our immigration control. We have to control the spread of the disease. There are a number of specific measures. First of all, we are going to stop flights and high-speed trains between Wuhan from Hubei province. Well, we want to make it clear. We will wait until we are fully in control of the outbreak before we will resume the flights as well as the high-speed train service with Wuhan. And then we're going to expand the health declaration system concerning the visitors from mainland. We're going to cover all the ports. The Department of Health will elaborate. Currently, we have the airport as well as the West Kowloon station being covered by the scheme. From now on, we are going to extend it to 3 other piers. That is the Tuen Mun Pier, the China Ferry Pier, as well as the Hong Kong Macau terminal. So it will also cover the port area of the Hong Kong Zhuhai Macau Bridge as well. Quite a large number of ports are involved, so we may not be able to complete the preparatory process for implementing the health declaration scheme. We'll try to do it as much as possible, and we will have a pilot scheme concerning an electronic declaration system. And we'll make it clear that for people who come in, and if they fail to declare or if they are dishonest in the declaration, they will be subject to a penalty. Maximum will be $5,000 fine and 6 months imprisonment.
The third measurement, we will step up the thermometer body temperature control. This is ongoing, but it can be stepped up when necessary. And we will also test for body temperature for those exiting Hong Kong as well. This will take time to implement. We will first give priority to Shenzhen, Macau, and Zhuhai, and also on travel health measures. Earlier in the Security Bureau websites and on the information website, we have given notice regarding the Wuhan disease, telling people not to go to Wuhan city. Today, we will update this proposal. The whole Hubei province will be a place that people should not go to. The Department of Health will closely monitor and update as necessary. Another measure, I believe, is the 6th one. We will suspend all visits for cultural and sports activities within the mainland that are sponsored by the SAR government. And then we will lower the risk of the disease spreading in Hong Kong. We will cancel mega events or major events which have a large audience, whether it's organized by the government or by other bodies. Earlier, we already announced that the international gala show in Western Cultural District and also the Chinese New Year Cup football match will be cancelled. And we also announced that the New Year evening gala meeting will also be cancelled. Then the marathon to be held next month will also be cancelled. This is not organized by us, but this is with our close support, and it involves 70,000 people, and it's a high-risk situation, and we think that should be avoided. And since the SAR government has to devote full attention to fight the disease, now the various New Year festival gatherings, including those organized by me and the other members of the government will be cancelled, and we will pay close factors to whether there will be a large congregation of people, whether there is a risk of cross-infection, and if there is we will also consider whether the organizing body has the ability to trace the persons who participate. And then a measure of recent concern is about our students. Today we announced that we will postpone the resumption of classes by kindergartens, primary schools, secondary schools, and up to, that will be postponed to 17th of February, and we will further assess as necessary. Because so many students will be going to school, a high risk of infection may be threatening. And then later, the Secretary for Education will inform you about the arrangements for the students during this period. Now, the longer holiday is not for the students to frolic. They shouldn't go out that often. They should try to stay at home as much as possible. And also we will ask the tertiary institutions to take adequate preventive measures, now especially where there are hostels at the universities. I know that the universities have taken preventive measures, and we will remind them to step up the measures. Fourthly, that's about social welfare facilities, whether it's in care homes or daycare centers, resident day centers. We feel that these centers need not be closed right now because many disadvantaged groups will have to make use of these facilities. Now, the SWD has written to these organizations that provide these homes and centers, and we provide them with additional resources, and we remind them to step up the cleaning of the facilities, and to remind them that there should be body temperature tests for the residential staff, the residents, as well as visitors. And then the next measure is that for different government departments with public facilities under them, for instance, the public wet markets of the FEHD, the LCSD libraries, playgrounds, and swimming pools. There will be more frequent disinfections, and especially where public take escalators, we will do the necessary cleaning. And especially for the children's facilities, where the children might get into health risks. Now we will remind the airport authority, the bus operators, and private property management companies to step up preventive measures. And we will urge the public to take action to step up their personal hygiene. All members of the public should pay close heed to personal hygiene. The Department of Health has issued many guidelines, and later Professor Chen and Dr. Chen will give you more guidance. Now, I know members of the public are concerned about the supply of face masks or surgical masks that you are all wearing. Now, the SAR government will take further initiative to increase the supply of surgical masks, and it's not just for the public or institutions. We also will try to increase the supply that can be available for sale to the public. The Chief Secretary of Administration, I believe yesterday, together with the Secretary for Health, has met with the main surgical mask suppliers in Hong Kong to understand the supply situation. Now, we understand that recently there has been a strong increase in demand for these face masks, and there has been a shortage. The suppliers try to increase the supply, but because there are some factories manufacturing these surgical masks that are on vacation during the New Year period, this supply will be short temporarily. And it's agreed that we will work together with the manufacturers so that we can resume a steady supply within a short time to meet the market's demand. With the support of the ASEAN government, the suppliers will try to locate suitable sources from the mainland and from abroad. The ASEAN government will try to provide all possible assistance so that we can resume an adequate and stable supply. Now, the mainland is still the main source of supply for our surgical masks, so I wrote personally to the State Council today to ask them to provide necessary assistance.
As to the other strategies to cope with the outbreak, like the alcohol, gel, hand rub, as well as bleach, we will be watching the supply in the market. The government will also acquire a large quantity of such supplies to make sure that the supply is adequate. And then the fifth strategy is that for the Department of Health as well as the hospital authority, we are going to enhance their service. Say, for example, we have designated clinics at the hospital authority. We have also got isolation facilities. Professor Chen and Dr. Koh will brief us on the work related to this front. Finally, for the sixth strategy, for the above-mentioned strategies as well as the initiatives, if there is a need for resources, the administration is committed to provide all the extra resources needed. In other words, we're not going to be constrained by lack of resources. For the sake of public health and public safety, we are not going to be frugal about our resources. So for whatever resources needed by the government departments, hospital authority, and even the universities in relation to tracing and research work, we will not spare any resources. We will not be frugal about the resources needed. Well, sometimes we may need to resort to exceptional measures, and then relevant organizations may be worried as to whether the government is going to pick up the bill. I can assure you that as long as it is in line with the goal to prevent and control the disease, we are willing to provide the necessary resources. Say, for example, the hospital authority may need to provide hotel accommodation for the staff, and then for staff involved in testing work, again, they may have to work overtime. We are going to provide the resources. And then for schools, if there is a need to be flexible about the use of resources to prevent and control the disease, we are certainly going to tie in with the needs to cope with that. We are now in the year 2020. We're faced with a number of challenges. First of all, social events that started in the middle of last year. There is a lot to follow up. There may still be some protests or acts of violence. And then the economy is entering a recession. This is unavoidable. And then given this outbreak, it means that many businesses are facing an even more difficult business climate. The SAR government will continue to watch the development, and we are willing to listen to the industries and the businesses. As in the past, both the CE as well as the Financial Secretary will come up with mitigatory measures. Finally, I would like to appeal to the public. On this occasion, we need to stand united. so that we can prevent and control the disease. We hope that we can safeguard public health as well as public safety. First of all, I'd like to give the floor to Dr. Gabriel Leung or Professor Gabriel Leung. He will brief you on the latest position, and then the other colleagues will also elaborate on the different measures. Gabriel. Thank you, Chief Executive. Friends of the media, good afternoon. Happy New Year, and I hope that everybody can enjoy good health. Now we are faced with a very serious challenge in terms of the outbreak, and I hope that we can safeguard the health of the community in Hong Kong. First of all, let me talk about some basic medical and scientific information. I should know that in the past week, different teams and different research organizations in the higher education sector have done a lot of work, like clinical work, public health work, microbiology, etc. And we have also been carrying out modeling work. And then we have combined the findings, and we have come to the following preliminary findings. I would like to talk about three parts. First of all, the transmissibility. Second, the clinical spectrum of severity, and then in terms of the testing as well as the clinical information. First of all, transmissibility. Well, in the past few days, as you know, the WHO, the World Health Organization, held an emergency committee meeting. It was an emergency meeting. Well, the Director General of the WHO decided as to whether there would be an announcement to say that it has reached the state that it is a public health emergency of international concern. Well, from that, we have also got some information about the transmissibility. On our part, our team has also carried out some work, and last week I announced the results of our mathematical modeling. According to the latest information, and in fact, last night we have liaised with the headquarters of the WHO, and then about a dozen of countries have also carried out their mathematical modeling. Well, if you talk about the R0, the multiplication sort of figure, it is about 2 as far as the median is concerned. In other words, for each infected case, on average, the 2 close contacts will also be infected. In other words, for each patient, there will be 2 other patients who will be infected in turn. And then we have to look at the doubling time. In other words, how long it takes to double the number of infected cases. As it stands, it is about a week's time. Well, as you may want to know, how does it shed light on the situation? Well, 17 years ago, we had the SARS outbreak. I think currently the position is similar to SARS. Well, for SARS, in the beginning, again, originally, the figure was between 2 to 3. The factor was 2 to 3. As to the doubling time, to double the number of cases, again, it took 7 to 8 days. In other words, the outbreak is not weaker than SARS. And then in the year 2009, we have the swine flu. At that time, the factor was between 1.4 and 1.5. In other words, we can see that for this novel coronavirus in Wuhan, I think at that time the swine flu has a lower multiplication factor than this one. But then for the generation time, it was half or 60% of this coronavirus. In other words, for it to be doubled, it took 4 days. So the basic multiplication factor may not be as high, but then the time taken is almost double what we have got. In other words, to sum up, you can never afford to take it lightly. It is a serious matter. And then having said that, we have to see for the doubling time as well as the factor to multiply, well, in the absence of any public health intervention, then it will sort of spread, as I have mentioned. In Hong Kong, there are no signs to say that in Hong Kong we have our own source of transmission. We have got cases, but then there are imported cases. For imported cases, we have yet to have evidence to see that there will be continuous transmission locally. In other words, our strategy should be as follows. That is, we should continue to have the containment measure. In other words, when we have an imported case, the case should be isolated from management so as to stop the chain, that is, one patient spreading the disease to two other patients. Before he's able to spread the disease to others, if he can be isolated from management, then it will mean that we are having the containment policy, and we should continue with that. But of course, we have to admit and we have to understand that virus doesn't observe any border, and it is impossible to rely on a single government or single place to ask the virus to stop.
Now, same as in the case of the pig flu, now our containment was, it started on Labor Day, 1st of May, the first imported case from Mexico. We contained it, so we delayed it to 45 later before there was the first case of local transmission. So we hope to do the same. We hope to successfully contain the disease all the way till the disease gradually dies down. Now, in case we cannot contain it, there might sooner or later be a case of local transmission. We must be prepared for that. And then the clinical level of spectrum of severity. 36 hours ago, in Youth Surveillance, a periodical, we already released a figure saying that if you fall ill and you have to be hospitalized, the mortality rate is about 14%. So 1 out of 7 or 8 who is infected will die from the disease. Now, compared with SARS or any atypical pneumonia case, it's similar. In SARS period, the mortality rate was 17%. Now, we cannot turn it in, we should not turn it into a case fatality ratio. I was talking about the hospitalization fatality ratio. It was based on all cases where it's necessary to be hospitalized due to seriousness. Now, what's different from SARS is that when you are infected with SARS, you are almost 100% due to be so seriously affected that you have to be hospitalized. So the disease will manifest itself sooner or later, and it will end in hospitalization. And in another periodical, just within the past 24 hours, the team led by Professor Yun Kwok Yung also observed that the clinical spectrum includes more cases of slight symptoms or invisible, so-called invisible cases. Now, if you don't notice these cases, there may not be hospitalization necessary, and the person may recover or may not recover by himself. So there's a risk of transmission. So there are more of these slight cases. So the overall fatality rate will not be as high as in the teens, of teens percentage. And then the test method. Now, Professor Chao Bin, now he's a very famous doctor in Beijing, and he had an article in Zhejiang, and he found that in many slight cases there's no pneumonia, and in fact there might not be any respiratory infection. In some cases there was fever and diarrhea, but there was no respiratory tract infection. So we have to understand that it's difficult to test. And finally, we have to look at the period of dormancy. Now, it affects how long we have to observe. Now, the dormant period might now be seen as 6 days. That is so in some cases it can go to 14, 15, or 16 days. Now, so I've told you about the scientific data that is to show that in Hong Kong we can make use of these scientific data in our efforts this time. We owe our ability to the hard work of several teams, and there is a research fund at Food and Health Bureau. They have a fund that dispenses commission grants for these diseases, and the Department of Health has also commissioned some studies. The Department of Health also supported a cooperation center with the WHO, and so thereby we can exchange information and cooperate with the mainland and with the international organizations. The government and the two main universities have continuously been in exchange with experts in the mainland and abroad to help our fight against the disease. Professor Hui yesterday, he headed a meeting, a scientific meeting at the Department of Health, and they came up with some useful conclusions. And Professor Yun went to Wuhan, and he did a lot of work. And I myself, in the past 48 hours, also led 5 persons in a team to Beijing to do this sort of work. So I hope you will continue to support these scientists and doctors who have worked in the background. And I reiterate again that we must be highly vigilant, but we must be cool-headed in our fight against the disease. We are still engaging in a containment effort. There is no evidence of local transmission in Hong Kong as yet. And we must be prepared that even if we adopt all the measures, it may not be foolproof. There might sooner or later be local transmission. If that day arrives, then our policy will shift to mitigation. We cannot stop the disease, but we can slow it down so that all our response mechanisms will work. Now, you remember that in the case of the pig flu, we also adopted the same policy. Now, as a doctor in public hygiene, I would like to remind you all to wash your hands, and you must have sniff and cough etiquette. So when you sniff or cough, you must cover your nose and mouth for the sake of the people near you. And then you must take injections. Now, this is also the peak season for influenza. Now, if you take the injection, then the medical staff will be aware that at least you have been covered for flu. Now, also in congested areas such as on public transport vehicles, you have to take all necessary precautions, including wearing surgical masks. Now, surgical masks are not omnipotent in every case, and you must wear the mask correctly. Now, you might say, why don't you wear the mask yourself? Well, when you talk, you have to take off your face mask, right? But you have to wash your hands when you take off the mask, and you have to wash and you clean your hands with alcoholic agent. And so even if you wear a mask, you have to be careful with hygiene. And also, you know that Hong Kong has a high rate of myopia, so you have a protection of your eyes. But if you don't wear spectacles, you should still try to wear a pair of glasses that is not for myopia but to protect against droplets in the air. And now, Professor Sophia Chen.
Thank you, Chief Executive. Friends of the media, the Chief Executive have already mentioned that our response level has been raised to that of emergency. For the past 3 weeks, I've been leading the fight against the disease, and we have never stopped our work. And now that the response level has been raised to emergency, it means that all our work and all the actions will be in the light of the latest situation, being enhanced so as to make sure that we are deploying the most effective and most efficient way to carry out our work properly. Well, for the strategies that we have been adopted, they have the following focus. First of all, at the border control points, we'll enhance the cleaning work and the hygiene. And we are well prepared with the necessary statutory powers to control the infection. As you recall that on the 8th of January, we already gazetted the regulation under Cap 599, so that in terms of isolation and notification, we have the statutory backup, and then clinics, etc., have been enhanced in their contingency capability. The CHP, the Department of Health, and the Hospital Authority are responsible for the work. In a moment, I'm going to invite the Director of Health as well as the Chief Executive of the Hospital Authority to add to my briefing. And then we have been enhancing our quarantine work as well as the surveillance work. Well, on the 31st of December, that was the time we were notified, and then as you can recall that the CHP has been extending the scope of surveillance in the light of the development of the outbreak. And for the hospital authority, in terms of patients' care as well as isolation facilities, again, they have been responding to the progress. And then we have maintained an openness, and we have maintained transparency, and we have been liaising and cooperating with both the WHO, the mainland counterparts, as well as other overseas counterparts. As you know, that the CHP has got a dedicated website, so that you know about the points to note, as well as the vital information necessary if you need to go out, and also during your sort of normal activities. And together with the ISD, we will be carrying out more communicative work. And then under the SCMA, we have a working group, and we will continue with our publicity work. Well, as the C has mentioned, we have benefited from the advice and analysis of the experts. We want to make sure that our prevention and control work is appropriate. And then for the FHB, now that the response level is pitched at emergency, will coordinate the work of the Department of Health as well as the hospital authority in terms of prevention and control in the patient care facilities, and make sure that they are capable to cope with it. And we will deploy the resources needed as soon as possible to cope with the situation. Finally, I would like to express my gratitude towards the frontline staff of our Department of Health as well as the hospital authority for their hard work. Well, we have all stood united, and we would like to control the disease. A number of measures have been measured. Bearing that in mind, it means that we will enhance our efforts. We want to be sure that we are effective and efficient in the deployment of resources to prevent what Professor Leung has mentioned, that is, we would like to guard against an outbreak in the community. Director of Health. Well, for the health declaration scheme, earlier on, for direct flights from Wuhan, the scheme covered that, and currently we don't have any flights from Wuhan. Yesterday, for high-speed trains from Wuhan, that was covered by the healthcare health declaration scheme. This will be extended to other ports. And then we have liaised with a telecommunications provider. We have a pilot scheme, and it's been started at the West Kowloon station, hoping that the electronic declaration system can be introduced. And then for body temperature checking, we'd like to see if we can use new technology to enhance the efficiency. And then for the isolation facilities, Lady Macleod's holiday camp has been commissioned, and then Lei Yun Woon Park and Holiday Village is ready. In order to cope with an increase in the number of people requiring isolation, we have already liaised with NGOs to see if we can make use of their holiday villages. We've also started our communication with the housing department so that for a housing estate in Fanling, there will be conversions for the time being to see if we need the facilities for the isolation of close contacts. We have also noticed that for frontline staff, in the light of the SARS experience, would very much like to have the following arrangement so as to put their mind at ease. They may not want to go home, and they would like to have a place to spend their night. The hospital authority is aware of this. The government is trying to see if the hotel sector can allow the hospital authority to lease certain accommodation facilities. Thank you. Dr. Ko. Currently, there are 5 confirmed cases being treated at Princess Margaret Hospital. All of them are in a stable condition. Our medical team have been working with our experts in relation to the treatment when we are watching their conditions closely. As has been mentioned earlier on, we have about 1,000 hospital beds with negative pressure. 500 or so have been used on a standing basis, and the utilization rate is between 50 and 60%. And then for negative pressure wards that have been prepared will gradually be used. So instead of 517, we have 603. And progressively, more and more negative pressure beds will be made available so that if there is the need, we can allow more patients to be isolated in such negative pressure wards or negative pressure beds. In addition, we have also got other measures so as to step up our efforts. Say, for example, for laboratory testing, we are cooperating closely with the DFH so as to make sure that we can enhance our capability to test for the virus. For patients who need the test, we hope we can complete the test as soon as possible. Other than testing for the coronavirus, well, as Professor Leung has said, we are having the winter surge, and so whenever there is a need for the testing for flu as well, we hope this can be done ASAP. As you can tell, earlier on in the past, for certain notifiable cases, patients suffered from fever as a result of other conditions. And we hope that we'll also make sure that the medicine is adequate. And then the CE has said that we are ready that if necessary, we can commission the dedicated or the designated clinics. We've examined the hardware workflow process of such designated clinics. We'll be watching the development of the outbreak closely. Say, for example, if we do have a large number of citizens requiring treatment, within 48 hours' time, we can commission or open the designated clinics. In addition, in order to allow the hospital authority to provide the necessary facilities, we need to adjust our services. After the Chinese New Year, we are going to make changes to the non-urgent operations, and other non-urgent services will need to be adjusted accordingly. And then in order to allow our staff members to focus on the fight against the disease, especially for those who are residential, we need to cut down on the outpatient clinic sessions. And of course, we can have refill clinics so that those who are in stable conditions can get their prescriptions refilled if they do not want to come to special outpatient clinics. Well, in fact, we have already got a mechanism to carry that out. Well, at the same time, if indeed one day we need to open the designated clinics, as you know, for the designated clinics, they are currently providing general outpatient clinics. If we need to open designated clinics, it means that we have to reduce the service of the general outpatient clinics.
Now, also to step up control, emergency control within hospitals, we will reduce the time available for visits, including for some emergency wards. We might even have to suspend visits altogether. We will do these step by step, and we will also explain to the public. And as the CE mentioned, for our staff, we provide a lot of support for our colleagues. We make sure that they have enough protective equipment, and we are aware of their concerns. For instance, as the CE mentioned, we will try to arrange for overnight stay by our staff. If the staff do not want to go home immediately, we may provide temporary quarters, for instance, by renting hotel facilities. And we will try to make appropriate deployment and shift arrangements. Finally, Secretary for Education, the delayed resumption of school. Now, given the confirmed cases recently in this disease, and since there are more visits abroad and inward visits during the holiday period, there is heightened risk. So to protect school children, special schools, kindergartens, primary schools, and secondary schools will resume school later, that is on the 17th of February. We will, in the meantime, review the situation, and we will also liaise with the tertiary institutions to ask them to consider delayed resumption of school. Now, during this period, the schools will remain open. There will be a suitable number of staff to take care of children where the parents feel it's necessary to take them to school. Now, as for pre-scheduled tests and examinations, these should be cancelled. Suitable arrangements should be made, and the parents should be informed. Now, during the extended holiday, we encourage the children to stay home as much as possible. The schools should provide learning material through the computer facilities, and so that the IT facilities, so that the students can learn at home. We hope that the parents will cooperate, take more care of their children, provide better environmental hygiene, avoid taking the children to crowded locations to reduce risk. And we also ask the schools to make proper preparation for resumption of school, that is, to prepare for cleansing materials, to take care of the school children. There should be thorough cleaning, and there should be stepping up of hygiene education. Now, as for the $2,500 the subvention, now originally the forms filled by the parents should be returned by mid-February. So we will extend the deadline for the forms by 2 weeks to 28th of February. And given that Wuhan of Hubei province and other provinces are still undergoing the disease situation, we will ask the schools and universities to stop exchange activities for the time being, and we will transmit the latest information about the disease to the schools and to provide support to the schools. Question time. Please raise your hand. Please inform us about your organization first. Cable TV. I'd like to ask the CE. Now, you mentioned that you hope to be on top of the disease in all your measures. Now, some countries do not admit travelers from Wuhan. Now, will you extend the control to those returning from the mainland? Now, the cases are now not just limited to Wuhan, but within China as a whole. Now, so can you adopt these measures? If not, are there political considerations? And on wearing surgical masks, now it's been said that you will. The government says that it will try to arrange with the State Council and other government departments for adequate supply of surgical masks. Now, the whole world is competing for surgical masks. N95 is selling at a very high price right now. Well, perhaps you should let the CE answer the question first. Now, I'd like to ask about operation. Now, many operations are announced by the CE today in one go. Now, these measures, have they been considered have they not been considered by your colleagues not until today? Is it that because you were in Switzerland, so the hands are tied? Now, we have never stopped our efforts to review our measures in prevention and control. And at every stage, we work on an orderly basis. Some of the measures are announced today, but all the measures have been based on the work done in the past few weeks. We have reviewed the situation. We decided we need to step up the response. So it's not an issue of waiting for me to come back, because the work is being done in public hygiene. And even though I was in Davos, I never kept I never let up my contact with Chief Secretary for Administration and with the Secretary for Health. And I don't rule out announcing further measures in a couple of days. We need to stay atop of the situation all the time. We cannot be at a standstill. Now, as for mainlanders coming to Hong Kong, as Professor Leung said, we are engaged in a containment policy, so we are keeping surveillance at the boundary crossing points and adopting the necessary measures. For instance, now actually there are no high-speed rail trains or flights right now from Wuhan. If necessary, but if we cut off too many flights and train services, this is not practical right now because these people can still come to Hong Kong by other means. So we don't consider any factors other than what is appropriate. All the factors are for the health of the public. We do not consider any other factors in relation to our relationship to the mainland. I believe the mainland authorities are giving us the full support given the close contact between Hong Kong and the mainland, and we will not spare any resources. As for wearing face masks, now we say that when you go to congested areas and where there is any danger of infection, or if you feel rather unwell, you should wear a mask to prevent infection. Now, of course, cutting back on major or mega events or major events will reduce the risk. Now, of course, the supply of face masks is now rather short during the New Year period. Now we negotiated, we have contacted suppliers in the mainland and others and suppliers who have other production facilities, and we are trying to get these supplies from all possible areas so this is to meet the demand not just for the government organizations but also for the public. Now, regarding our request to the State Council, now there are mainland factories. They are willing to operate more shifts to produce the masks, and we hope that the supplies will reach Hong Kong as soon as possible. TVB, I'd like to ask the CE. Now, there are many measures today. It's like a big gift to Hong Kong on CNY1. Now, why can't you give the gift earlier? Now, we have more and more identified cases. For instance, the health declaration at boundary crossing points. Now, the official said that, declaration is secondary. People might not put it down and declare. The temperature test is the more important. Now, actually, you can repeat the measures that were adopted during the SARS period. Why are these measures not adopted till the CE comes back? Now, how do you assure the public that they can get the face mask? Now, I already replied regarding the supply of face masks. We will take a very positive approach to increase the supply of masks. Now, some people were earlier worried that we get the mask for ourselves but not for the public. Now, I make clear that we actively, proactively seek to increase supply for all 7 million members of the public. Now, some sources were not previously made use of, maybe because the prices were high, but now we don't spare any resources. We give priority to increasing the supply. Now, As for why some measures are not adopted till today, now some of these measures are a stepping up of previous measures. They have proven to be effective, so we have stepped them up. Now, the major date was 23rd of January. That was the day when we confirmed 2 cases of the disease from the mainland. So that took us into a new stage. So we have to raise the response level to emergency. So with that, upon that change, we need to adopt also emergency measures. So we have to be more vigilant, and there are no other considerations.
The one in the back row. I'm from Now TV, Hong. Well, there are medics saying this online, saying that you need to fight the disease at source. Now, today you talk about together fighting disease, and Professor Leung said that we had to get prepared for a local outbreak. So does it mean that you're not going to close the boundary crossing points so as to stop the number of imported cases? Rather, you would wait for a case to be confirmed before you step up your efforts. Now, medics have said that if you don't close the BCPs, if you don't step up your measures, they may start a strike. And then at Tuen Mun Hospital, there was this case. That is, there was a suspected case in which the patient was accommodated in a ward. I want to know how many other patients were there as well, how many medics also come into contact with her. So is it because of a lack of facilities? Well, you've got 3 questions. We have been working in a systematic way, and at each stage it has been supported by the evidence and data from the experts. Closing our BCPs, I will defer to Professor Leung to tell us what he as an expert would say about closing BCPs at this moment. And then Dr. Koh can also talk about the case in Tuen Mun Hospital. I think it's a matter of some medical or some healthcare professionals have told us about their demands, and they have threatened to take some radical action. I sincerely urge the public that we need to be rational, and then we can fight against the disease. 17 years ago, when there was the SARS outbreak, I was the director of social welfare. We were totally dedicated. We didn't mind the SWD working overtime and just leave everything to the hospital authority. In fact, every one of us took an extra mile so as to share the different work pressure, anxiety, and workload in the fight against the disease. Well, currently, there are healthcare workers who think that they are worried about the workload, and they are afraid whether the protective gear is adequate, or they're also worried whether there are adequate arrangements for them after work. If they have such concerns, please have an exchange of views with us frankly. I think we can always have dialogue instead of deferring to radical actions. Maybe for the past 7 months, the society has grown used to resorting to radical actions. But then it is a very serious matter, and it is a matter of public health. So I will urge everybody not to resort to radicalism to fight for your aspirations. Thank you, CE. I think I'm just repeating what I have said a few days ago. A few days ago, I gave a news conference to make announcements about the mathematical modeling. I think there was an overseas media friend who asked me this question. I said that for anybody involved in public health, in fighting against disease in particular, when you need to make decisions about policies, when the outbreak is serious, everything must be scientifically based. Any other consideration should be set aside, in particular political considerations. Otherwise, you are bound to fail. Let me say this again. All the control measures everywhere related up to the WHO, you need to have faith in science. Any other considerations that are not based in science could not be admitted into the picture. As I have said, and friends of the media, I think you know it full well, that is, in the past 48 hours, well, in fact, it was thought that they would only need 4 to 5 hours to complete the meeting of the emergency committee of the WHO, so as to form the WHO's view on this novel disease. On the first day, they had to meet for 8 hours. They couldn't come to any conclusion. And then on the second day, another 6 hours of meeting. So after over 10 hours time, they came to the conclusion. That is, first of all, yes, the outbreak is serious. That's the words of the WHO Director General. But then they were saying that it is not yet up to the level of public health emergency of international concern. And secondly, he made it clear that there was no need to issue a travel advice against China. I think the decision was made with a lot of scientific support. And then if you care to look at the dozen-strong committee membership of the emergency committee, well, you can see that they come from countries that have close cooperation with our motherland and others who don't. And so there's no political consideration at all. So you need to have faith in science. And then locally in Hong Kong, if you talk about closing the boundary crossing points, well, you need to remember that for the past 20 years or so, starting with the avian flu, SARS, swine flu, and then for H7N9, when we didn't have a local case, all the way up to now, I think never have we, whether we have got our own local case or whether we had an imported case from mainland China, South Korea, Canada, Singapore, etc., we have never closed our BCPs. Now for Wuhan city and the cities surrounding Wuhan, I think they have a population of 20 to 30 million. Now they are sort of having a lockdown. I think it is internationally recognized as a decision because obviously it is an infected area. But in the case of Hong Kong, we are a transportation hub. From the perspective of a public health scholar, I think if you close the BCPs, it means no one can go out, no one can come in. That's the way to do it, instead of pinpointing a single country or a couple of them. Even if you want to do it, can you really do it? And you need to understand that we cannot have a 100% outcome. All that we can do is to manage our risk. As I have said, every day when we carry out public health decision making, it is always a piece of Swiss cheese. The holes will be large. It cannot be 100% foolproof. But then what is clear is that the holes are at different locations. As long as you have got sufficient number of them, then it will be very, very difficult for the holes to be made into a single line. So it is a matter of having a policy of containment. And it is also a case of mitigation, and has gained international recognition. And over the years, we have done so on scientific data and evidence. This morning, the three of us, myself, Professor Yun, and Professor Hui, as well as Professor Keiji Fukuda. I think if you recall, back in 1997, we killed the chicken, and he was the principal representative of the CDC, and he came here and then he hasn't left. For such experts, we have all shared the same opinion. That is for us to consider the option of closing the BCPs. It is not a proper decision and it is not appropriate. It is not feasible. So I think you would recall that for matters on public health, I have never allowed politics to enter my consideration. And this is not the first time that I make such a point.
Dr. Ko, now, as for media reports of a problem with an affected patient, now I like to deliver an apology today. Now, we have met with the hospital staff concerned. Now, we have conducted a thorough assessment. I believe the hospital will have a press briefing later today where you can get more information.
The government has identified its first highly suspected case on the 22nd. On the 23rd, you were in Davos, and on the 24th, you spent a day traveling back. And on today, you rolled out this basket of measures against the spread of the virus in Hong Kong. Could they not have been implemented in your absence, given some of them were actually suggested by local academics and experts before you arrived in Hong Kong? Could they not be put in place earlier? Second, why set up these expert panels when the advice given by renowned microbiologists and medical experts in Hong Kong, such as to roll out more health declaration forms in all ports and then stepping out your contingency plan level, has been made days before you arrived back in Hong Kong and were not answered by your government. So why set up this expert panel if you're not going to listen to them? And also on the mask ban, is the government going to continue its appeal on the court's ruling that the anti-mask law is unconstitutional, given that the novel coronavirus has reached Hong Kong? Why has the government not made an official appeal for people to wear masks in public? Thank you.
Well, of the three questions, first of all, throughout the process, it lasted for about slightly more than 3 weeks now. Throughout the process, we have been taking forward our actions in a very systematic manner based on scientific evidence and advice from the experts. I would dispute your allegation that we have not been listening to the experts. So Professor Chen has been meeting with the experts. Dr. Constance Chen has been meeting with the experts almost on a daily basis to take their advice. But what has happened is we reached a critical point on the 23rd of January when there were 2 confirmed cases of this novel coronavirus. So at each stage, the government's actions and reactions have to take into account the latest development, the severity of the public health situation, and the advice that we receive from our experts. So I thought that was a very simple sequence of events. There was absolutely no intention or plan to delay actions because of other non-health reasons. And it also has nothing to do with my absence from Hong Kong, because despite my physical absence, I've been keeping in close contact with the Chief Secretary, the Secretary for Food and Health. So I hope that we will see this in a very rational way. The second point is about the experts. As I said, the experts have always been there to help us in providing the scientific evidence, the analysis, and advice. But there are advice that maybe you will regard that we could not implement immediately because there are operational issues that we have to make sure before we could implement it. So to have large numbers of health declaration forms in all the border control points could pose problem. That's why at the same time, the health authorities, together with the support of the Innovation and Technology Bureau, have now put on a trial run of doing this electronically. So we are in a better position as a government to assure the people of Hong Kong that when we introduce a measure, we are able to do it, despite not immediately, but we have plans to implement that particular measure. And we will continue to listen to the experts. The reason that the chief executive has appointed an expert panel is because, as I said, we have reached another higher level of emergency. And in order to shorten the distance between the communication of the experts with the highest authority in Hong Kong to make that decision, I think it is a very good idea for me to have direct access and for the experts to have direct access when they have discovered something that they should immediately bring to my attention. I understand that this higher level access of an expert advisory panel is also a recommendation from Professor Yuen Kok Yung, given to me actually earlier today. So I'm sure that with that sort of communication, we will be able to deal with the ever-evolving situation of this virus more effectively. Well, the court ruling has nothing to do with this public health plan. But I would just explain that the appeal against the court decision was not so much on the anti-mask regulation made under the ERO. It's an appeal to make sure that there is still this constitutional validity of the emergency regulations ordinance. Because for any government, for the executive not to have any powers of that sort could, in a way, impede us in responding to emergency situation. I'm afraid I have to stop here because the case is still in a judicial process, although the court hearing has taken place. So I have said a little bit more commenting on this case, but I really don't think I should go further into a case which is now before the court.
下一條，白色衫位。
你好，香港。
RTHK, I'd like to understand about the closing of boundary crossing points. Now you can see that there are some provinces and cities in the mainland which have already implemented strict closure measures. Now, would Hong Kong wait till a more serious outbreak before you consider these measures? Now, maybe you don't have to close the BCPs altogether, but there should be more stringent measures to contain the virus. And there are a whole series of policies. Now, it's been said that the policies measures are rather late. Now, Macau and Taiwan already adopted some such measures. Now, are there barriers that you had to overcome? How did you overcome them? Are there difficulties in your decision making? Are you waiting for more confirmed cases before you adopt such more aggressive measures? Are there more aggressive measures that you have in your quiver to counter the evolving situation? On the closing of BCPs, we already answered that question 2 or 3 times. Now, I can only say that in handling the disease out, we have to keep reviewing the situation. Now, those in the WHO or in the mainland or in Hong Kong, we all have to keep reviewing the situation. The WHO made the decision after 10 odd hours of consideration, and maybe they will soon have to reconsider. Now, when the WHO reaches further conclusions, we will likewise do the same ourselves. Now, in public policy, we cannot sit there and maintain the status quo. You can be assured that when the situation changes, now when the disease evolves, unfortunately, into a local outbreak, we will certainly adopt other measures. Now, as for the policy-making process, as I said, a major consideration is, of course, the confirmed cases. Since the beginning of January, we already put the response level at serious. Now, now the confirmed cases do make people more concerned, so they will be more receptive to what you refer to as more aggressive measures. Now, of course, we don't consider popularity as a factor in public health measures, but we have to consider whether we will have a broad support by the public. Otherwise, they might not comply with the measures and our objectives will not be achieved. So I don't think we are late or slow. Now, you gave an example, say, on the resumption of school. Now, well, we are thinking now the schools are in holiday anyway, so we will announce these measures along with the others today, and we cannot just adopt any date. We have to consider whether it would be 1 more week or 2 more weeks, and maybe we should let them have 1 more week so that there can be better learning by internet. So we take a holistic consideration. There are no so-called difficulties. Now, for supply of masks, in Macau, they limit the number you can purchase. In Macau, in Taiwan, they prohibit export. Now, when you wait for the situation to become more serious, then you always fall behind. Wouldn't that be a worry? Now the major worry is now the supply of face masks. Now, if you have a shortage and you restrict the purchase, then the supply, shortage is more serious. So we try to increase the supply. Now, there are many industrialists who manufacture face masks, or they know of manufacturers in the mainland, and so on. So we are exploring all these channels. Only when the supply is increased can we improve the distribution. Now, some people suggest limiting the quantity one can buy, or you can consider supplying quantities to certain organizations. We will consider all such possibilities. Last two. Today is first day of CNY. Will the public have to find their own solutions? Now, the government didn't call upon people to wear face masks till rather late. Is that because of the court case? Now, many people come to Hong Kong by the express rail through Shenzhen. Will you reduce the number of services, train services from Shenzhen by XRL? Now, will you only adopt more stringent measures on declaration only when there's a more serious outbreak? Now, if people arrive by other channels, will you prohibit them from entering? Now, will you ignore the risk to the frontline staff? Now, let us all be united in our efforts to fight the disease. Now, the Director of Health, in responding on the circumstances where one should wear masks, now, if you question about her point, I think you are making your guess is, I believe, very far off the mark. You might have reason to suspect me if you wish, but I think it's a bit far-fetched to question the director who has spent all her years in maintaining for the sake of public health. Now, as Professor Gabriel Leung said, we have scientific evidence. We put the public health as the top priority, and we try to be scientific and rational. Now, as for telling people to wear face masks in all cases and by everyone, now, of course, that's possible, but we have to consider what's most effective. The approach is now, if you go to a more congested area, or if you are unwell yourself, or you have to care for others yourself, or you provide service in a enclosed environment like an aeroplane, I think that would be the appropriate cases where face masks should be worn. And I saw the airline staff wear face masks on my way back, but not in every case. Now, we try to proactively increase the supply of face masks, so at least in the meantime, try not to go to the congested areas, and that way we can cut down on the use of face masks as well.
Well, today our XRL service can reach 58 destinations directly. Of course, as of now, we have suspended the service to Wuhan, but then others may come to Hong Kong via Shenzhen, etc. Now, for citizens from Wuhan or Hubei as a whole, well, are we going to stop all the relevant train service? If we do, it is tantamount to closing our BCPs. And in fact, there are also other channels to come to Hong Kong. Now that Hubei province has adopted a very stringent measure to stop the citizens from leaving, then I think it will also help with the fight against the disease. For our airport, we have stepped up our efforts to carry out the surveillance. Together with the airport authority, we'll consider the following. We have got many flights on a daily basis. Perhaps we can focus on certain flights, and perhaps they can be centralized in a particular apron area, and then we can step up our body temperature checking work in a more effective manner. The final question.
It's from AFP. Chief Executive, why is your government 48 hours behind the first highly suspected case to realize that you need to get ahead of the epidemic? The second question is, how many mainland Chinese visitors have entered Hong Kong since the Hong Kong government got a report of the novel coronavirus from mainland China? And how many of the patients being treated in public hospitals or under monitor or isolation in public hospitals are actually mainland Chinese visitors or visitors from Wuhan specifically? If such influx of visitors are going to continue, how is your strategy of containment going to work? And the third question is, earlier today there is local report that at the Sha Tao Kok checkpoint, the immigration officer actually allowed a mainland Chinese man with fever to enter Hong Kong. Can the government confirm there is such a case? And if if science has told us that patients at the early stage of the disease might have mild or even no symptoms, how is the current monitoring strategy going to work? Because you're mainly looking at fever. 3 questions, thank you.
I have no details about the shuttlecock case. I just checked my colleagues whether they know anything about this. No, we don't have any information about the shuttlecock case. But what you have described is perhaps the difficulties we are facing in dealing with this virus, because the symptoms may be mild or even invisible at the beginning of the onset. So that's why I appeal to all of us that we should all do our part to help in the containment of this rather tricky virus. Well, as far as the timing, I have explained that in the whole process, since receiving notification, we were very much on the alert. At every stage of the situation, we implemented measures with a view to contain and sort of arrest the situation from being deteriorating. So similarly, when the first 2 cases were confirmed in the evening of 23rd January, the Chief Secretary for Administration has already hosted a press conference to announce some of the measures that we are going to put in place. Following continuous monitoring and discussions with the experts this morning and amongst our own colleagues, we came up with another package of the strategy with the detailed proposals. But you will notice that some are actually enhancement to existing things that we have been doing in light of the situation and the resources that we wish to put into these measures. I wouldn't say that this is a delay because the situation is evolving and we are putting in the best responses to control the spread of the virus. As far as the number of patients being treated in isolation facilities, I don't know whether Dr. Goh has any information on that, and the overall workload on the public hospitals. But I remember Dr. Goh has already described in detail the various contingency measures that the hospital authority will implement in order to free up more capacity to deal with patients that require to be monitored or be treated in this public health incident.
Because one of the notification criteria of patients who are admitted and being notified and also tested is that they have been visiting Wuhan. So all the patients that we have notified have history of visiting Wuhan. So up to today, 12 p.m., we have cumulative of 305 cases who fulfill the criteria, and all of these cases have history of visiting Wuhan. And of course, our main concern is we are closely monitoring the epidemiology involvement, because the notification criteria may have to be adjusted according to how the infection is going to change. And accordingly, as mentioned by the Chief Executive, we are doing works to increase our isolation beds and also laboratory and the weather-related capability, so that if more patients need to be treated and isolated, we will have the capability to do so.
Sorry, speaker is off mic.
Such patients, our main concern is the epidemiological link, whether they have visited Wuhan or not, and we treat and manage all this case in the same manner.
今日記者會到呢度，多謝晒大家。
That's it for today's press conference. Thank you.